service. We have other, from our sites, they have really projects that related to TB or TB node had much contribution. I'm trying just to mention them because of time. I won't go in too much. So we have several projects from Kibomoto site, from KCRI sites, from Kemri, Kisumu. Yeah, so that is all as regarding the work package 2. But on the mentorship again, as I said, we have one postdoc, we have 2 PhD and 4 master's program in all country, in all our sites that were involved. We conducted the course, I talked about it earlier, but we have also seniors contributing to teaching in universities. And this is what I really call it fostering scientific leadership. And by doing. There is a training, yes, but if there is something that they can do and learn from it, then we thought this is much more better. So in terms of PhD, these are the projects for the PhDs and masters, but also for those who I call junior and mid-career levels, who are not in PhD, in whatever, but they are in our sites. They are the ones that we took up in the research method course. They came with a concept, but at the end of the course, they have 2 pages proposal with these titles, and these are the country where they were coming from. And then when they went back, we requested the senior within the TB node to mentor and supervise them until they have a full proposal and submit it to ethical clearance. In Uganda, IDI, they have already, this junior fellow has already started doing a project as a PI under the supervision of the seniors. In Tanzania, they are now submitting to ethical committee, and in other countries as well, they are about to submit it to ethical committee. And those were targeting the junior one and mid, but for the senior one, we have directly mentored them to apply for EDCTP fellowship grants that are being advertised or on yearly basis. And we have done a number of them. Some of them we became successful. Some of them we were not. Like in this first slide, we went several stages, but the final one we didn't get. But I show you the effort, because there's nothing. These people gained the knowledge on how to write and apply into a grant. We have one that last week we were told that EDCTP is going to fund. And this is again in the area of prevention of diabetes in Africa and in HIV patients. The pre-diabetes is common in HIV, and here we are trying to prevent them from going to full diabetes by doing a trial using metformin. We have investigational product for metformin, but we have a placebo. And last week we received the good news that the EDCTP is going to fund this project. One fellowship application was successful, and we have a fellow who is now at Glasgow in the UK for six months in modeling, but later on he comes back to continue his program in Tanzania. In terms of infrastructures, well, we did those assessments, and we have again sent money to all sites except Sudan, where we are not able to send money for that. We are a little bit behind in terms of establishing samples for stories. But in terms of database, I have talked a bit on that, and this last just shows different projects that have contributed to the capacity for data management. The TB node database I was talking, this one, this is online and is active, and it can be accessed by our partners in the 5 the 5 countries. We are waiting for those ethical clearance, and then we start to collect information and populate. Yeah, and all these, again, these are the database that were developed by our people. They are a web-based database that we have engaged to, and this is a platform called Readum, and we have like several projects that are on using the database. Another good example is the NCT database, in where all countries are uploading data into a one portal, and the central management is at TB, it's at Nimri Muhimbili Center. So we have this is functional and people are using it. I'm not saying it is perfect, where we see something we improve. Yeah, in terms of infrastructure, I won't bring everything here, but for instance, in Tanzania, we have Mwananyamala, the one I was talking about. This was EACCR1, but since number of clinical, it has attracted number of clinical studies, we have to expand it a bit more, and this is on construction. This is a lab from our site in Kibomoto, a TB lab. The accreditation, lab accreditation issues, we have the Kisumu Kemri, which was accredited, but we also have the Central TB and Reference Laboratory at Nimbi Muhimbili, which was also accredited in March this year. Yeah, in terms of communication, I think Ben also talked about this with the other network like Pandora and so on, have been networking with them. I won't go into detail, but I have included all publications since we started. We started the East African Consortium for Clinical Research. And our main challenge again, I think we have discussed a lot, is how to make Sudan work effective. That is the main challenge. The communication things keeps on improving, so I don't have much to blame on that. Thank you very much.